to today's Google Hangout session, Barriers to Healthy Habits and Advocating for Change in Your Community. My name is Jason Morgan, and I'm the Director of Global Health and Wellness for GE Healthcare. Today, I'm joined by Colleen Doyle, Director, Nutrition and Physical Activity for the American Cancer Society, and Carter Steger, Senior Director, State and Local Campaigns, also with the American Cancer Society. Colleen, Carter, welcome, and thank you for your participation in today's discussion.
Thank you. Thanks.
At the end of today's discussion, we will be offering a Q&A session. If you would like to submit a question for our panelists, you can do so by using the question feature on the Google Hangout page or on Twitter using the hashtag #TacklingCancer. With that said, let's go ahead and get started. Obesity, physical inactivity, and poor nutrition are major risk factors for cancer, second only to smoking. The World Cancer Research Fund estimates that up to 1/3 of all cases of cancer in the U.S. can be attributed to poor diet, physical inactivity, overweight, and obesity. Today, 2 out of 3 American adults are overweight or obese, and nearly 1/3 of adults worldwide are not physically active enough. In fact, about 3.2 million deaths worldwide are attributed to poor diet, physical inactivity, and obesity. So, Colleen, why should we develop healthy habits? And the second part of the question, what do you think is stopping people from making healthy lifestyle changes?
Oh, thanks. Great questions. You know, it's so important for people to look at their diets, look at their activity levels, and see what kind of changes, what kind of positive changes they can make, because doing so has a huge, huge impact, certainly on your risk of developing cancer, as you mentioned, but also heart disease, diabetes, quality of life issues as well. And to your point, many of us in this country are overweight or obese, putting us at risk for a number of different types of cancer. The majority of us don't eat as many fruits and vegetables as we really should. Half of us we're not active as much as we need to be. And those things, again, are really important for lots of different reasons, and certainly, as I just said, cancer. But you make a good point, too, is that there are a lot of challenges for us to do these things, lots of barriers just about everywhere we turn in terms of eating well and being more active. We know one of the major issues right now, looking from a diet perspective, are portion sizes. You know, most everything we eat huge portion sizes of, and whether we're eating out at restaurants or even now that we're eating at home, portion sizes have gotten large, definitely contributing to the weight trends that we're seeing in this day and age. Food is available just about everywhere you go. You know, no matter what time of the day or night, you have access to sodas, foods, you know, lots of different places that we can access food and drinks on a regular basis throughout the day. We also know that lots of advertising and marketing, particularly of foods and beverages that aren't necessarily in our best interest, is absolutely fueling some of the obesity epidemic we're seeing today, particularly when we're talking about kids. And we also know, from a physical activity perspective, lots of barriers to being active. Many of us live in neighborhoods where we can't safely go outside and walk or ride our bike. The way we design communities is really much more amenable to being in a car than it is being on foot or on a bicycle. So lots of different barriers, again, to people being able to make healthy choices on a regular basis. But the good news is we can change. We can create healthier communities, and we can really make it easier for people to eat better and be more active.
That's great. Thank you, Colleen. The American Cancer Society has a cancer action network that has volunteers who advocate for change in communities every day. Carter Steger, who joins us today, is the Senior Director of State and Local Campaigns for the organization. Carter, can you tell us a little bit about the Cancer Action Network?
Yeah, sure. The American Cancer Society Cancer Action Network is the advocacy affiliate for the American Cancer Society. We refer to it as ACS-CAN for short, as the other is a bit of a mouthful. So ACS-CAN works to encourage candidates and lawmakers and policymakers across the country to make cancer a top national priority. You know, what many people forget is that every day lawmakers are making decisions on a whole host of public policy issues, including cancer. And ACS-CAN wants to make sure that our voice is heard when these decisions are made. We do this through a number of ways. We lobby, we have a grassroots power, we have policy expertise and communications, and we use all of these tools in our toolbox to amplify the voices of cancer patients and our advocates as cancer policy decisions are being made. Because we know that if a law is passed, we can affect millions of people's lives in just by passing one law. And that is certainly a big help for eliminating cancer as one of our major health problems.
That's great. Can you provide some examples or share some success stories where CAN has changed things in a community? And how does this help people to reduce their risk of cancer?
Sure, I'd be happy to. And I should say that we're actually now in the planning stages for the 2015 legislatures, and Congress is still in session, and a lot of local communities are grappling with some of these decisions now. But I'm going to just talk about some of, like you said, some of our successes, some of the things we've been working on to give you a flavor for what you may see us working on in the future. So at the federal level, we worked on the Healthy Hunger-Free Kids Act, which made a number of changes to improve food and beverages that we now find in schools. So this was really important. That act is being revisited currently, and we're working really hard to make sure that we don't have any backslides in the law, and we keep the strong provisions that are currently in law. You also may have noticed that you're seeing menu labeling or calorie counts when you go to buy something at a chain restaurant. We've supported the Federal Menu Labeling Act, which now requires that for all standard menu items for chain restaurants that they list the calorie count, which I know I find really helpful when I'm trying to make the decision on what to eat when I'm out at a restaurant. In D.C., in Washington, D.C., we helped pass the D.C. Healthy Schools Act. It enhances nutrition and healthy eating in schools. It sets a minimum requirement of minutes for physical education and health education. It improves the school environment, regulates competitive foods, those foods that are sold outside of the normal school lunch and breakfast programs. It requires a wellness policy, and then a plug to one of our other policy initiatives that makes sure the campuses are tobacco-free. Across the country, we've also been helping to increase the amount of funding that goes in to support state obesity programs. We've done this in states like Virginia and Alaska and North Carolina and Maine. And in Minnesota, picking up on something Colleen was talking about, that people in some communities don't have access to safe places to walk or exercise. We've had a couple of policy changes. In Minnesota, we helped to make sure that the bike routes and the sidewalks were safer for schools. And along the same theme, in Seattle, we supported an initiative between the Park and Recs Department and the school district in Seattle to open up schools on off hours, either before or after school, so that people in the communities could come in and exercise and play basketball and be active in a safe environment. It's not all communities are safe outside, so it's important to have access to facilities where you can feel safe and go and be active. We've also been doing a lot at the local level in California on a whole host of policies, one of which is we've been working to restrict the marketing of food and beverage companies to kids, to make sure that that not all restaurants are handing out the really fun toy that encourages the child to maybe not make the healthy option when they're getting lunch or dinner. And at the state level in California, we actually had a little bit of a setback, but we'll be back. We worked on a policy that's a little new for us this year, and that is we worked on a piece of legislation that would have required that there be a warning label on all sugar-sweetened beverages, and the warning label would have told consumers that if you drink a sugar-sweetened beverage, you stand the risk to increase your risk of obesity, diabetes, and tooth decay. As I said, this bill wasn't successful, but we'll be back, and it's just kind of the nature of the process. Sometimes you're successful right out of the bat, and sometimes you have to come back a couple of times for a number of years, but we don't give up. So this is a flavor of the sort of things, no pun intended, that we're working on across the country, and you'll see these sorts of policies in our portfolio next year.
Well, that's outstanding. It's great to see that a lot of these initiatives continue to have great momentum and success, and the American Cancer Society is doing great work, not just locally, but all around the nation. So that's outstanding. Thank you. Just as a reminder, if you would like to submit a question for our panelists, you can do so by using the question feature on the Google Hangout page or on Twitter using the hashtag #TacklingCancer. At the end of our discussion, we will take a few minutes to answer any of the questions that have been submitted. So this last question is for all three of us. So far, we've learned that the importance of getting involved in groups, how to stay or get healthy either through work or community, and how to spread the word and advocate for change. Carter, I'll ask you first. What are some ways in which our participants can get involved locally through CAN or otherwise?
Well, we're always looking for more advocates, and whether you want to officially call yourself one of our volunteers or not, you can go to our website and sign up to receive action alerts from us. And we'll let you know when something important is happening, and you can then let your lawmaker know that you care about the issue. If you want to get a little more involved, you can officially become a member of ACS CAN, and that would provide you just a little bit, a few more services from ACS CAN to help your experience in advocating. And then we also have events, lobby days, and trainings that we would love to have some of you join us for as well. But it's easy, at the very least, I hope everybody listening to the Google chat will go to acscan.org, sign up to get our action alerts. You can then see the other items that you can get involved in and self-select according to the time you have. But it's real easy, and you can go to acscan.org, and I'll repeat that again, acscan.org, and just sign up for our action alerts, and we'll be in touch. We won't overwhelm you, I promise, but we'll let you know when important things are happening.
That's great information. Thank you. Now, Colleen, there's also ways in which an individual can make a change. Can you speak briefly about that?
Oh, sure. Yeah, absolutely. It really, from my perspective, this really is a village thing. It takes all of us speaking up and helping to create change, whether as a formal ACS CAN volunteer or not. But, looking, a lot of us, our work, we're employed and we spend a lot of our waking hours at the office. Look around your office. If you don't have healthy foods available in the cafeteria or a vending machine, if you don't have flex time policies that allow you to get out during the day and go for a walk sometime, speak up about those things. We can absolutely make changes in our workplaces by using our voices. Same thing in our neighborhoods. Carter talked about accessible. Or having access to healthy, affordable foods, having the opportunity to have sidewalks or bike lanes or safe places in your neighborhood for your kids to play. All of those things are things that we can and should be speaking up and advocating for. And we really can make a difference. The good news is, even though we kind of started off talking about the overweight obesity rates in the country, people not eating fruits and vegetables, people not being as active as they need to be, these are all things we can change and have a really positive influence on for ourselves, our family, our colleagues, our neighbors as well. So it really takes all of us, and we can change things.
That's great, and I'll speak briefly on this from a corporate wellness perspective. Some of the different things, and I think it was mentioned earlier as well as the environment and things in which we can do to help change that. I know that within our company here, our cafeterias and vending machines are very supportive of creating a culture of health. We have 75% healthy options in both our cafeterias and our vending machines. We itemize and label those products so that individuals and employees can look at that and make an easier decision on what is healthy and what isn't. It really takes and eliminates some of the different barriers and challenges that we've spoke about today. Things, fitness facility, we're fortunate that a lot of our sites have an on-site fitness facility, but for those companies or businesses that don't, it's as simple as creating a space in your building where you can bring somebody in from the outside. Maybe it's a fitness instructor or a personal trainer to educate and teach people how to exercise properly and what would be considered a beginner exercise versus an intermediate or advanced. A walking path. We spoke, I think it was brought up either Colleen or Carter, about different ways, safe environments for people to exercise and engage in physical activity. The workplace is a perfect opportunity for that, whether it's outlining a walking path in your building, or promoting the use of stairs instead of the elevator. Walking programs or running clubs are also great programs that we can do. Most of this requires very little effort, but can have a big impact on the health and wellness of employees. So small changes making big impacts. Now I want to make sure we have time for some questions, so I'm going to stop there. First of all, I want to thank Colleen and Carter for their time and expertise today in discussing a very important topic. Again, if you want to submit a question, please use the Google Hangout page or Twitter using the hashtag #TacklingCancer. So I think one of the questions here that we have actually from the Google page is, can healthy habits help prevent all cancers? So Carter, Colleen, if you guys would briefly chat about that.
Yeah, that's a great question, and the answer is no. Unfortunately, we can do all the right things, if you will. We can eat more fruits and vegetables. We can eat whole grains. We can watch the amount of red and processed meat that we eat. We can exercise, and unfortunately, we can still develop some cancers. But for the majority, some of the major cancer sites that or some of the sites that are major sources in this country, breast cancer, colorectal cancer, those absolutely can be influenced by what we eat, how active we are, and what we weigh. And so while eating well, being active can't prevent all cancers, it certainly can influence a large number of them.
That's great. I think we've got a great comment from Twitter here from Tanya that she says she cut out sugar and noticed the difference in a couple of days. More clarity and less lethargic. I think these are something, again, a small change, but a big impact. And I think that's a perfect example of what just creating healthy behavior change can do. And so another question that came through here is, as far as the trends, people asking, are we even getting a little bit healthier? How are we seeing things project, and how are we trending at the current moment?
From an overweight obesity perspective, the good news is it looks like for women overall and for kids that obesity levels are leveling off. Unfortunately, they're still too high, and some population groups have higher rates than others. But it looks like a lot of the positive, a lot of those policy changes that Carter mentioned. We're seeing changes like this throughout the country, and we're really starting again to see some of these trends leveling off, which tells me there's a lot of good work going on out there that make it easier for people to eat better and be more active.
Yeah, but Jason, can I just add to that? Just a caution, policymakers start to see that things are getting a little better, and then their attention span kind of leaves the topic at hand. So it's going to take us a while to turn these obesity rates around, and I think we need to be sure to make sure that lawmakers understand that even though we may be leveling off on our obesity rates, the job isn't done, and we're going to still continue to need to make personal changes as well as policy changes to make sure that that we don't start to see the rates start to rise again.
Okay, great. Colleen, can you comment or talk briefly about the idea behind making healthier foods more cost-effective? Is there, no pun intended, an appetite for that at this point, or where are we with that, and what is being done at the moment?
Yeah, I would say there's a huge appetite for that, and this is a great time of year to talk about that issue, particularly because we see a whole lot of fresh fruits and vegetables available this summer, and that's one of the key things that when you talk about healthy eating being cost effective is looking at buying things that are in season, and so now is a great time to really start eating more fruits and vegetables because they're inexpensive, they are available like they are, not necessarily year-round, but now is a great time for that. And also, one thing too, people, particularly when you talk about fruits and vegetables, people will always ask about, well, what about frozen? What about canned? Does it have to be fresh? What's the best thing? And certainly, again, right now when everything's in season, it's less expensive. But frozen fruits and vegetables, canned fruits and vegetables can be largely as healthy as fresh fruits and vegetables, depending on how far those fruits and vegetables had to travel to get to your house. So, those are year-round, tend to be less expensive options for people, as long as you're getting frozen fruits without added sugar, frozen vegetables without added sauces or butter. And from a canned perspective, looking at canned vegetables that don't have sodium added to them, and canned fruit that don't have added sugar to them. So those are some affordable choices on a year-round basis.
No, that's great. I think. Go ahead. I'm sorry.
Can I just add that one of the policies that we work on too is to make sure that all communities have access to healthy foods and vegetables. Not all communities have grocery stores that are well stocked with pretty fruits and vegetables. We work on policies to make sure that happens, and as well as making sure that schools have access to local farm produce that's healthy and fresh as well. So these are some of the other policies we work on.
No, that's great. I think one of the things that's interesting is here within the site that I'm located at for GE Healthcare, we've created a small space for individuals to have a little small plot to grow fruits and vegetables in, and it's worked out really well. It's a nice feature. It's fairly easy to do if businesses if you work in an area, or rather live in an area where you don't have property to do that, the business can sometimes do that as well. So just looking for options at the workplace to be able to do that. Now we've got another question on Twitter from Beatrice, and she asks, what healthy habit impacts more on the risk of developing cancer, food or physical activity?
Great question, and certainly they're both related and frequently go hand in hand. There's, the biggest risk factor, I'll tell you, for the majority of Americans who don't smoke, which right now about 80% of us don't smoke, the most important thing that we can do to reduce our risk of cancer is to watch our weight. Weight is a really big risk factor for developing cancer, certainly. This question of, is it food or is it physical activity, it's both. We need to be eating better. We need to be more active. Both of those things have a tremendous impact on, number one, your weight, and also your risk of cancer. So think about those habits going hand in hand.
Okay. Again, if you would like to ask a question, you can do so by using the feature on the Google Hangout page or on Twitter using the hashtag #TacklingCancer. We've got another question from Shavleen. I hope I'm pronouncing that right. How do you change your mindset? I know the right thing to eat and important to exercise, but I'm still stuck.
There's probably a lot of things you can do, and a lot of us feel that way. So don't feel like you're alone in feeling stuck. One thing that might help is getting a support system. We know that people who work out with friends, who have family members who support what they're doing, make it easier for people to stick with these habits. And so sharing what you're trying to do with your friends and family members can help them be a motivation and a support for you moving forward.
Yeah, and don't try to do everything at once. You can start off with making a few changes. Sometimes we overwhelm ourselves by trying to decide we're going to run the marathon as opposed to just getting out there and walking.
No, I agree. I like that idea of celebrating the small steps rather than trying to celebrate after you've actually completed a larger one. This is a comment from Kim, and one of my favorites here. It says, teaching kids early about good nutrition and the importance of exercise is important. Can you guys, you talked briefly about the schools and really engaging kids in schools and programs at an earlier age. Can you speak a little bit more about that?
Yeah, I think this is such an important issue, and particularly when you look at childhood obesity rates right now, the scary thing is that kids who are overweight tend to become adults who are overweight, putting them at risk of developing cancer, heart disease, diabetes, etc. And it's really important to get kids started on the right foot at a very young age, and it's exciting to see a lot of programs even targeting child care, at the earliest levels or the earliest ages of kids being in daycare. So really important to establish those habits early on. And for those of us who are parents, being a role model for good behavior is critically important. We know parents who eat more fruits and vegetables tend to have kids who eat more fruits and vegetables. Parents who are active tend to have kids who are active. So certainly as a parent, that's something we should all be thinking about in helping instill those habits early on in our kids.
No, that's great. I think to that point here, Curtis has a comment on the Google Plus that says, getting rid of processed foods can help reduce sodium by a large amount. This also results in less sugar intake. Eating real food and learn to cook your own. I think that's a very, very good comment, Curtis. We have
Here.
a question from Todd. Can you offer a single diet change that most people can implement with some ease that will help with better health?
Here's what I always encourage people to do right off the bat is take a week and write everything down that you eat and drink. Write down what you eat and drink, how much you eat and drink. Are you alone? Are you with somebody? And really, writing things down tends to be an intervention in and of itself. But it's a real awareness-raising tool. A lot of times we don't necessarily realize how much we're eating or how frequently we're eating throughout the day, or even if we're eating when we're not hungry. So I would do some journaling like that to start with, and then going back to what Carter said earlier. Starting with one change. One simple thing that you think you can do and be successful at. For a lot of people, I'm going to commit to eating 2 more fruits and vegetables throughout the day. For some people, it might be I need to cut back on the amount of soda I'm drinking. So it's a real individual thing. You need to really look and see what are you currently doing and what makes the most sense for you moving forward.
That's good. Just as a reminder, again, if you've got a question, we've got a few more minutes, so you can ask your question either through the Google Hangout page or on Twitter using the hashtag #TacklingCancer. One other question here: does ACS-CAN research all cancers?
I can start off with this, and Colleen, feel free to add in. Yes, ACS-CAN does. We're an organization, or ACS actually is the science portion of ACS CAN, so we get all our policy effort, or our policy and science background from ACS, and ACS is the largest non-governmental funder of research in the country, next to NIH and NCI. And ACS has grants that go out for research on all sorts of cancers. ACS CAN supports the research work by advocating for funds to, governmental funds to go into research for the governmental side of the research answer, and that would be funding NIH and NCI. ACS itself, though, does not receive any federal funding to support our research program. All our research program is funded by our donations. Colleen, I don't know if you want to add anything to that or not.
I think you covered it great.
Okay, good. So another question here: what can I do at the local level to ensure government is advocating for cancer research funding?
Well, you know what I'm going to say. I'm going to say get involved with ACS-CAN by going to acscan.org and signing up. You will get alerts. It's one of our biggest, it's one of the things that we advocate year-round, every year, and right now, to be honest, the funding of research at the government level is in great danger. I'm sure hearing lots of discussion about the federal budget, and there are lots of cuts that different programs are taking, and we really do fear that the research budget will take a cut. Certainly, even if it doesn't get an increase, one can argue that that's a cut because it's not keeping up with the inflation and the need for more and more research. I really believe we have seen so many cancers, either there's a cure or a better treatment that has happened because of the research funding. Research funding is so important, and we will go from having a disease where some people die to a disease where it's a more chronic condition, and research funding is the key in that. So please join us. Again, acscan.org.
Yeah, I didn't know what she...
All right, so this is a sort of a fun question. What's your view on wearable devices? I'm sorry, what's your view on how wearable devices can help to prevent cancer? So Fitbits, Jawbone. I'll provide my feedback here in a second, but interested to hear what either Colleen or Carter has to say.
Yeah, I think they can be great motivational tools for people. People who like gadgets, who like to be able to see just how much activity they're getting throughout the day or how long they're sleeping. I think they can be really positive for people. And I think it's an individual preference, certainly, but if you are somebody who likes gadgets, likes numbers, it's a great way to track and stay motivated.
Yep, I've got mine on. I don't know if you can see it. I got one on myself. It helps. I won't say I've completely changed my behavior, but at least I have awareness.
Yeah, I think that you'll start to see a lot of people, for a lot of people that like to track, I think it can help with engagement, and obviously if you're engaged, then you're more likely to engage in healthier behaviors, which ultimately could help to prevent cancers. So I think that, you know, we're using a lot of these devices within our programming. You're starting to see more and more of these different things. It's only going to grow. You're seeing wearable devices that extend to T-shirts, and to you know, companies like Under Armour putting bioscanning, you know, different technology pieces into their stuff to help you track your programs and your activities. So I think that it'll continue to grow as we start to see more of the devices in the area. Another question here: what is your suggestion for someone who lives and works in an area that is not walking friendly?
Well, yeah, I'll jump in, Colleen. Then I know you've got a lot of suggestions, but you know, I mentioned the public policy route that we're taking. You know, but this takes time. You know, but I know that sometimes when I travel, I'll go to a local mall because I don't know the area. And you know, malls are, you know, if you can resist going in and going shopping, malls are, you know, places that, you know, you can do a lot of walking. You know, they tend to be safe. There's security, you know, at the mall. So, you know, that's one of the things that I do. Colleen, do you? I'm sure you have a lot more suggestions than I do.
Well, and I definitely try to not walk at the mall because I'm one of those people who just can't just walk at the mall. I have to shop at the mall. Yeah, I mean, I think this is a great question, and it's exciting to see more and more communities really looking at this issue of walkability and bikeability. And I think one of the first things, if you live in an area that is not walker friendly, is really start to increase awareness of that issue and get involved in initiatives. I know I live in a pretty walkable area, but we haven't always been that way. And we got involved with issues like walk to school days that really help to raise awareness of the community of how important it is to be able to walk, to be able to bike. So I think that's one of the very first things to think about is how you can raise awareness among city leaders of the need to look at issues around bike lanes, around sidewalks, around parks and green space. And certainly when those particular items come up for a vote in your community, be sure you are at the voting booth, you know, giving your voice to those issues.
Yeah, I'll second that. You'll be amazed at how many people who don't agree with you on these sorts of issues will show up for you know, these hearings. And so, and you know, it's all about the numbers. If we can pack or, you know, have a good number of people attend saying the things that we believe in at a community hearing or at the state legislature, we can change the way lawmakers vote on an issue. Remember that, you know, lawmakers are supposed to represent what you want them to do. And so if they see a lot of their citizens, you know, a lot of the people who live in their district in a committee hearing, they're more likely to vote the way we want them to on an issue.
Well, that's great. Thank you again, both. I think we're going to wrap up. Carter, if you wouldn't mind one more time, though, if you could just give out that web address for the ACS CAN. I believe it was acscan.org, but could you just remind individuals interested in learning more about that?
I sure will, and I'm glad you've memorized it, Jason. It's acscan.org. Please join us. I promise it's not as scary as it sounds to get involved in public policy, and it can actually be a lot of fun.
Well, good. Well, look, I think there's been a lot of really important things discussed today, and certainly I hope that everybody that's been participating has gotten something out of this. Again, I want to thank Carter and Colleen for their participation and riveting discussion on this important topic. If anybody does have any questions, you can reach out to us. I'm on Twitter at GEHC Wellness, and I'm happy to answer questions there. Otherwise, you can contact the American Cancer Society for additional information. But again, Carter, Colleen, thank you again for your time. Thank you for those that joined the call, and have a great day, everyone.
Thank you for the opportunity.